Interesting. The question about, there are two big areas that I want to, talk briefly about. One is Lyme and one is mold. So, Lyme is a very challenging condition for any medical providers to treat. What is your approach? Like, how do you attack this very tricky organism?
Well, Lyme, one of the hallmarks of Lyme is it causes immune dysfunction. So your immune system is not capable of defending itself very effectively. But if you take a step back, and this is what I've noticed in a lot of my Lyme patients and kind of in the more progressive Lyme community, is that there's usually a priming effect where Lyme actually triggers things, but the environment in the body creates susceptibility, or something in the environment of the body create a susceptibility for people to have worsening Lyme symptoms. And if you take it back, it could have been actually having mold in the body first. So mold could have been present, and some people may not have any major symptoms, but once you bring an immune priming event like Lyme, then a lot of symptoms can develop afterwards. Because some people can get bit by a tick and never have any issues. And then some people get bit by a tick and then they're bedridden afterwards. So what's the difference between those? And some might be the genetics, but a lot of what I see is just the environmental buildup that might have gotten to the point where their immune system was kind of on a teeter-totter, and then Lyme brings it over the edge. So that's what I've seen. And then some patients, they could overcome Lyme with just antibiotics and they do feel better, and some don't. And then you figure out why do those patients get better? But if they've never looked at, mold as an underlying issue, then you're not getting to some of the root of the issues. Because, for example, mold is a major immunosuppressor. So it's going to suppress your natural immunity. So you're not fighting things passively. So you might get better if you take antibiotics, but because antibiotics are doing the killing for you. But once antibiotics are gone, if the symptoms come back, your immune system should be the one that's defending you passively after that. But it could still be suppressed by something like mold. So that's kind of the approach I like to take. Is I round it out. Because there's also other factors like parasites and heavy metals and other environmental toxins and emotional stressors that are basically forcing your immune system to divert its attention. So you're focusing on so many factors that you can't really fight, the thing in front of you. We want to make sure that we can clear those things out, and that way the body has more, resources and attention to be able to deal with Lyme or any other co-infections that come with it. I think
you mentioned something similar with COVID, that people respond to COVID very differently. So why do some people, die, and some others don't even notice, symptoms?
Yeah. So a lot of it begins with their internal ecosystem. So if you're already unhealthy to begin with, just having high blood sugar or high inflammation, when COVID hits you, your inflammation is just through the roof, the body can't handle it, then you might die. But those who may not have high inflammation, but might have a suppression of their immune response, for example, people that have like long COVID afterwards, there's a correlation that they might have something like mold present that's kind of get their immune system on the edge, where they may not have any symptoms yet, but once a priming event again like COVID hits, then their body can't recover afterwards. So in those situations, the immune regulation is important to address the underlying cause, so that way they can get better,
How do you address then? Like, what is your approach? I assume nowadays long COVID is more prevalent than Lyme disease. I'm not sure. I'm not sure how I'm not sure the demographics, but it's something that a lot of people are dealing with in some way, shape, or form. So, from a infection standpoint, we try to address to see if there's any residual infections of the virus still persisting, or inflammation created from the virus that's still persisting. So a couple of approaches that we've taken that actually have cured patients with long COVID is antiviral approaches using some of our IV therapy. So like we do like a laser IV that enhances the antiviral effects with the medications that we use, or the supplements that we use. The technique is called photodynamic therapy. We do an IV that contains methylene blue, riboflavin, silver, and ozone, and then we chase it with laser afterwards. So the effect of what that does is the riboflavin and the methylene blue, they're uptaken by the viruses or other pathogens that are hanging on the system. So does silver and ozone as well too. But the riboflavin has a unique effect where it's actually going into the DNA of the virus and bacteria as well too. So it's contained there. The thing with riboflavin is very light sensitive. So when you shine light to that organism afterwards, it's forced to take in more light they can tolerate and cause oxidative stress in the presence of oxygen in the tissues. So it's basically oxidizing the DNA structure that's in that virus with the light.
Wow.
So you can selectively destroy viruses, parasites, bacteria in the bloodstream by doing this laser IV treatment.
So your own cells do not uptake them?
The own cells do, but they have antioxidant mechanisms to defend against that, oxidative stress. So there's really not much damage that occurs to our cells, but bacterial cells and viral cells just can't handle that much energy that goes in. The other benefit is our cells are receptive of light. So the different frequencies of light actually turn on various mitochondrial functions. So we have photoreceptors for the light too. So that's why we can actually use this light to our advantage.
Yeah, that's beautiful. I've come to really respect and love energy medicine. And then you're using it beautifully. You're using some, combine light with different molecules and you can really tailor the treatment. It's really awesome. So the methylene blue do the same things that they...
Yes. So similarly, so the methylene blue, it's uptaken and it's also receptive to red light. So methylene blue enhances the absorption of red light. And so bacterial cell walls, they absorb the methylene blue. And then when you shine it in, then they're forced to absorb more light and oxidative triggers. And then they start to, degrade as a result. So you're really selectively killing off these unwanted organisms very quickly in the presence of light. So going back to like the long COVID, in some of the cases that we've had with the patients, that was the way that they got better, is that we basically cleared out any residual, potentially viral and or other hidden infections from that, just the IV treatments.
Okay. And I know, of course, both silver and ozone are incredibly powerful. I've done podcasts just talking about silver and two podcasts just about ozone therapy. So both are really powerful antimicrobial therapies.
And they're all synergistic. So if you combine them together, you get multiple benefits on, regulating the immune system and the anti-infective approaches as well too.
Yeah, that's really awesome. So how long is one session, this IV infusion?
This combination probably like 2 to 3 hours, because there's, the IV laser part is about an hour because we go through different frequencies of color. And then the other nutrients IVs, depending on, what we do. If it's without ozone, it's usually an hour shorter. But if we do the other things, it stacks up to about 3 hours or so.
I see. How are you doing the ozone?
We do the major autohemotherapy. Right now we're doing single pass, which I find, it's all we need in the presence of this light. Although we're planning on getting the EBU technique. So having, full circulation eventually. We just need more space and more, hands on deck. Cause right now our staff are maximized with, all these different IVs that we got.
I see.
But for the meantime, the single pass ozone works well enough because we typically combine it with the light to make it more effective.
Wow. So how many sessions do people usually need?
Well, it always depends on what we're treating. For the example of some of my long COVID patients, they needed maybe like 3 to 6 treatments to see some significant changes in their overall presentation. But those that are dealing with Lyme or other more chronic infections, they may take a bit more. But it does make a difference, where people have gone through antibiotics and know how they can respond. This one changes the game because, first of all, it's not toxic. You're not hurting anything. You're not actually harming the gut at all compared to antibiotics. But you get the antimicrobial effects and the restoration of your mitochondria and other cells with the light. So you're actually tonifying the system as well as ridding it of pathogens.
And you use the same regimen for Lyme as well?
Similar, yeah. You can use the same one works across the board for a lot of different infections. And then we're trying a couple other ones that also enhance. So you can also add like high dose vitamin C, or now there's a new one, which is CBD. It's really neat that all these things have different antimicrobial effects and also immune regulating effects too. And artemisinin is another one too. Like artemisinin is parasitic and immune regulating too. So there's some interesting things, but yeah, it's a variation of these. So I usually customize it depending on the patient. There's not like one size fits all for everybody.